Hello, my dear friend. Welcome to the session of learning. Today, I will tell you about more important aspects of life, that is, living with the diabetes. Most of the peoples are suffering from diabetes, and they have to live with the diabetes because it is the disease which cannot be cured by medicines. It cannot be cured at all. You have to live with it lifelong, and you have to manage it. So management of diabetes is very essential. What is it? What is diabetes? Diabetes is a chronic, that is, you can say, long lasting health condition that affects how your body turns food into energy. Your body breaks down the most of the food you eat into sugar, that is glucose, and releases it into blood stream. When your blood stream have more sugar levels, it signals your pancreas to release insulin, and it is the insulin which is the most important thing in our body, because insulin is only responsible for converting blood sugar, that is glucose, into energy. When it stops releasing, then what happens? You get diabetes, life get damaged. This is very essential. You have to take care of it also. Now here I will tell 4 steps to manage your diabetes for life, because it is a lifelong disease. You have to live with it. Now, what are these 4 steps? Step 1, learn about diabetes. What is it? How can you manage your diabetes? And for managing diabetes must be well known to you. What is it? Second step is know your diabetes ABCs. What is ABCs? And how to know your diabetes ABCs? It is very essential. And third step is learn how to live with diabetes. And fourth step is get routine care to stay healthy. Step 1 and step 2 I will clear today, and step 3 and 4 I will clear next session. Now, what is step 1? Learn about diabetes. What is diabetes? There are 3 main types of diabetes, that is type 1 diabetes, type 2 diabetes, and then gestational diabetes. What is type 1 diabetes? Your body doesn't make insulin. This is a problem because you need insulin to take sugar, that is glucose, from the body you eat and turn it into energy for your body. You need to take insulin every day to live. Type 2 diabetes. This is the most common prevailing diabetes. Your body doesn't make or use insulin well. You may need to take pills or insulin to help control diabetes. Type 2 diabetes, that is, as I said, it is the most common type of diabetes. And gestational diabetes. What is gestational diabetes? Most women, or you can say some of the women, not most, some of the women get this kind of the diabetes when they are pregnant. Most of the time it goes away after the baby is born. But even if it goes away, these women and their children have a greater chance of getting diabetes later in life. So they should take care of it. Now consider yourself the most important member of your healthcare team, because now you have to live along with your healthcare team, because you have to live with your diabetes lifelong. You are one of the most important member who manages your diabetes day by day. Talk to your doctor about how you can best care of your diabetes to stay healthy and how to live with it lifelong. This is very essential. Some of the other persons who are now needed and who can help you are dentist, because there is chance that when you have diabetes, then your teeth get affected. So you should consult dentist. Then diabetes doctor, the most important person for your life. He prescribes medicines also, and also prescribes the foods, that is what type of foods we should eat and what not to eat. Diabetes educator, the most important person, because when you have to live with your diabetes, then you have to get well knowledge of the diabetes. What is it and how to live with it? This is the most important. Dietitian. Now, role of dietitian in your life is very essential. With the suggestion of dietitian, you can manage your food choices. What type of foods you have to take, what type of foods you have not to take. This is very essential. Similarly, eye doctor, because there is more chance that your eye get affected when you have diabetes. Foot doctor, friends and family, mental health counselor, nurse practitioner, pharmacist, social workers. All these are now very essential for our life, and we should consult all these because we have to live along with diabetes and we have to get help from all these persons. How to learn more about diabetes? Now you can take classes to learn more about the living with the diabetes. To find a class, check with your healthcare team, hospital or area health clinic. You can also search online, that is where classes are going on, and you can join there. Join a support group in person or online to get peer support with managing your diabetes. It is very essential to join a support group. Now read about diabetes online. Go to National Diabetes Education Program. Here you can get knowledge about the diabetes and how to manage the diabetes lifelong. Take diabetes seriously. What happens? You may have heard people saying that they have a touch of diabetes or their sugar is little high. These words suggest that diabetes is not a serious disease. That is not correct, my dear friend. Diabetes is a serious, but you can learn to manage it. You have to manage it. People with diabetes need to take healthy food choices, stay at a healthy weight, move more every day, and take their medicines even when they feel good. It is a lot to do. It is not easy, but it is worth it. Now, why take care of your diabetes? Taking care of your diabetes and your health can help you feel good today and in future also. You can control your blood sugar level, and when your blood sugar level, that is glucose, is normal, you are likely to have more energy. You can feel more energy, and you will feel more energy, and you will be less tired and thirsty, and you will need to pass urine less often. You can heal your body better, and you can have fewer skin or bladder infections. So it is very essential to keep the blood sugar level glucose under control, that is normal. You will have less chance of having health problems caused by diabetes, such as heart attacks or stroke, eye problems that can lead to trouble seeing or going blind, pain, tingling or numbness in your hands and feet, and also called nerve damage, kidney problems that can cause your kidneys to stop working, teeth and gum problems. All these problems you can fight when your blood sugar level is normal. Actions you can take. Ask your healthcare team what type of diabetes you have. Learn where you can go for support, and also learn how caring is important for your diabetes and how it will help you feel good today and in future also. This is very essential. Now step 2. Know your diabetes ABCs. What is the ABC? Talk to your healthcare team about how to manage your ABC. What is ABC? That is A1C, A for A1C, B for blood sugar, and C for cholesterol. This can help lower your chances of having a heart attack, stroke, or other diabetes problems. Now, A for A1C test. What is it? A1C is a blood test that measures your average blood sugar level over the past 3 months. It is quite different from the blood sugar checkups you do every day. Why it is important? Now, you need to know your blood sugar levels over time. You don't want those numbers to go high. High levels of the blood sugar can harm your heart, blood vessels, kidneys, feet and eyes. So it is very essential to test it. What is the A1C goal? A1C goal for many people with diabetes is below 7. It may be different for you. So you should consult your doctor that what should be your goal of A1C for yourself. It is very essential to take under control. Now B for blood pressure. What is it? Blood pressure is a force your blood puts against the wall of your blood vessels. Why it is important? If your blood pressure gets too high, you may have chance of heart attack or stroke. Your heart has to work hard more. It can cause heart stroke and damage your kidneys and eyes also. Now, what is the blood pressure goal? What should be blood pressure? The blood pressure goal for most of the diabetes people is below 140/90, upper 140 and lower 90. It may be different for you. Ask your doctor that what blood pressure goal should be for you. Now C for cholesterol. What is it? There are two kinds of the cholesterol in your blood, LDL and HDL. LDL or bad cholesterol can build up and clog your blood vessels. It can cause a heart attack or a stroke. HDL, good cholesterol. It helps remove the bad cholesterol from the blood vessels. It is very essential. What are the LDL and HDL goals? Ask your cholesterol numbers from the doctor. Your goals may be different from other people. If you are over 40 years of age, you may need to take statin drug for heart health. It is very essential. Actions you can take. Ask your healthcare team what your A1C, blood sugar and cholesterol numbers are and what they should be for yourself. Your ABC goals will depend on how long you have bad diabetes, how long you affected bad diabetes, other health problems, and how hard your diabetes is to manage. Depending on this, your goal will be decided, or your ABC goal will be decided. What you can do to reach your ABC goals? Write down your numbers on the record note and you should track the progress. That is, if you have achieved the goal or not. This is very essential, and after knowing all these things, you can manage your diabetes and you can live lifelong and you can feel healthy and very well from the body and mind also. Step 2 and step 3 I will tell in the next session. Thank you very much.